Let's go through the causes of vertigo in a short and precise manner. It can sometimes become quite challenging when we come across a patient sitting in front of us with dizziness or with vertigo, and we need to complete all our history in a short, precise way in a short period of time. So how do we go through different causes? So an important tip to remember when it comes to vertigo, most of the causes are starting from the head, going down through the ear, down to the neck and to the heart. So it's just like a question mark. What should I ask and what not? There are so many causes of dizziness. So it's just like a question mark history. What do we exactly mean by that? So I'll share a picture with you to make it easier and understandable. So if you have a look at this picture, what is your history? Where do you start from? You can always, after establishing that this is really vertigo and the patient feels as if the whole room is spinning around him, you can ask him, right, Mr. X, apart from this dizziness, have you had anything else? Like what, doctor? Any headache, blurring of vision, any focal weakness or weakness in a part of the body, any ear symptoms like pain, discharge, ringing, any hearing loss at all? You can go down to the neck. Why is it so important? I'll explain that to you in the end. Why is neck so important in the case of vertigo? So to ask about neck pain, and then to not forget heart, because that's a red flag as well. Any chest pain or any palpitation. So it's quite simple, short and smart, starting from the head down to the ear, neck, and then heart. So try to cover these 4 areas when you come across a patient with dizziness. Apart from these 4 areas, we've got 4 more questions to ask. What is it? Nausea, vomiting, fever, flu-like symptoms, vestibular neuritis, head trauma, which can be an emergency situation causing dizziness, and then loss of consciousness. This is how you can very precisely and nicely cover all your questions of dizziness, especially vertigo. Why did I say that cervical dysfunction is really important? It has been a long time in the general practice that I do come across a lot of patients who have been misdiagnosed with BPPV just because they feel as if the room is spinning around them when they change their head position. But essentially, if you ask your patients, do you have any neck pain? And they say, yes, doctor. They haven't had any recent flu-like symptoms or something, but they've got a neck problem. Do think of cervical dysfunction, because patients who've got cervical dysfunction due to osteoarthritis or other causes, they tend to suffer from dizziness quite often on moving their neck. Try to be a safe doctor. Wish you all the best. I hope this video was helpful. For more similar and helpful videos, please click and subscribe to the channel. Have a good day. Goodbye.